Hello, I am Dr. Meeta Airen. I am a fertility specialist. Today we are going to talk about IUI. That IUI is intrauterine insemination. This is a simple procedure which is done for fertility treatment for the couples who are not able to conceive because of some minimal problems and they are not having any great issues. So first we'll understand how what is IUI, then how it is done, why it is required to be done, then the procedure, and then we will discuss about the success rate of IUI. So first, what is IUI? So IUI is a process of artificial insemination in which the washed semen is inserted into the uterus of female so that sperms can get a better chance to freeze the to fertilize the egg. So this is the procedure which is very simple procedure done in the OPD basis, and the only thing you need to come little frequently to the fertility center. So basically this is not a very exhaustive thing, and you can do it on your daily routine. You can just go to your office and come to fertility clinic, and then this will help you in conceiving. So now we'll understand which are the couples who need to undergo IUI and what are the indications of IUI. So the most important and most commonly for what process this is to be done is mild to moderate male factor infertility. Those couples in which males have some problems in sperm, that is like low sperm count, then there is some problem in sperm motility or some morphological issues in the sperm. So these are the couples who need exactly the IUI procedure. When it is severe, then they might need some exhaustive treatments, and IUI may not help. So this is the first indication. Then next we can do IUI in those patients in whom females, they have some ovulatory dysfunctions, like females are not able to develop eggs, or they are not able to ovulate. In those patients also IUI help in the fertility. Then the third indication in which IUI is helpful is unexplained infertility. So in many cases we have seen so many couples that they do all the investigations, and every investigation is okay, still they are not able to conceive. In those couples also IUI help little bit, and many couples they conceive with IUI. So that is also an indication. Then further we can think about that certain couples, they are not able to keep relationship because of certain factors, like one is erectile dysfunction in males, then retrograde ejaculation in males. Then there are females who are not having they are not able to keep relationships because of vaginismus. In these females also we can just do an IUI, because it is a procedure which can bypass the intercourse. So these are the couples, they also need a IUI. Then there are certain factors which are usually not diagnosed, like cervical factor infertility. In these patients, females cervical area, it is not very ideal for the sperms, because sometimes the cervical mucus is thick, so they are not able to it is not giving way to the sperms. Then some cervical scarring because of certain surgeries or some other issues, these females also, they are having problem in conceiving. So these are the few indications for which IUI is the procedure which need to be done, and it is having a good success. Then now we will understand what is the procedure of IUI and how it is done. So whenever you will come to a fertility center for fertility treatment, you will be investigated, and if your investigations are suggestive of that you need to go for IUI, you will be subjected to ultrasounds from the second day of the period, and then on scans we will see whether your follicles are there or not, and then certain medications or few injections will be given to you so that your egg development is boosted. Once your egg is developed, then you will be called to the center, and once you will be given some injection for triggering ovulation, and then once your egg is ovulated, your husband will give the sperms, and it will be washed in the lab, so that this washing is done to process the sperms, and the best sperms which are having good motility, good morphology, they will be separated and concentrated, and then that processed sperm will be injected into the uterus. And this injection process is also very simple. It is an OPD procedure. You will be just lying down, and this is done without anesthesia, and by a simple procedure, it will be by using a simple very thin catheter, it will be injected inside the uterus. You will not feel any pain in this, and it is a 10-minute procedure, and you will be free to go to your office or home, wherever you can go. No post procedure, any injection, nothing will be given. Only few medications will be given, and then after about 2 weeks you will be testing whether you are pregnant or not. If you are not pregnant, then also we can try few other procedures. So in many cases this is very simple, and patient don't have any problems also. So this is the basic procedure of the IUI. Now I will tell you what are the risks of the procedure. Relatively this is very simple procedure, no risks are at all associated. The only risk which is there is sometimes you may have a multiple pregnancy. This is the risk which is that is also very less, because if you are having a tendency of having twin pregnancies in family, then it can be there, or if there are many follicles inside the ovary which are ruptured, then there can be chances of multiple pregnancy. Then there is a theoretical risk of infection or bleeding, but that is usually not happening much. So this is a very easy going procedure, so you should not be very scared about it. And if your doctor is suggesting IUI for you, you should go ahead with that. Now we'll last but not the least, I will discuss you about the success rate of IUI. So IUI, whenever a couple is trying naturally without any procedure, then in each cycle, if everything is okay, the chances rate of pregnancy is 10 to 15%. But when we attempt IUI, these chances are increased to 20-25%. So it is a good chance. If a patient is not able to conceive, then 20-25% in each cycle is a good chance of pregnancy. So I think we have discussed in detail. So anything, if any doctor is suggesting you IUI, go ahead with it, and don't be scared of it. Thank you.